Okay, we've got time for probably a couple more, and then or one more, and then we'll shut down. And this one's more for Dr. Lynch. I think it's directed to you. Is it the thought or the hope of combining SGB with other treatments that will become a permanent solution? Or is it still going to be, 6 to 12 months? We're looking at another one, another injection. How are you? I mean, what do you think as far as the future of that goes, or do you know it all?
Yeah, great question. I appreciate that. I think, and this may be a little different from some comments that we may have just heard, but I do think the short answer is I think it'll require further studies. So that's easy. We need longer term studies to see the long term effects. But to me, it's clearly evident in the hundreds and hundreds of patients that I keep track of that those who engage in good, high quality talk therapy of a variety of different types will have extension of their stellate ganglion block effects much further than those who do not. So there's definitely a synergistic thing going on, which is I think where I maybe differ a little bit in how others look at how to approach treatment. It's a little bit like combining therapies. For anyone that's had orthopedic surgery before, many times you go ahead of time and do prehab, right? Or do physical therapy ahead of time to strengthen the musculature before another procedure. And it's just in preparation for that. And their term did not come up today, but interventional psychiatry gets brought up occasionally with the idea that if we do things, they can then make the brain more plastic, which Dr. Holzheimer brought up that terminology. If we can do something to put the brain in a state where it can become more effective to heal, then that's a good thing. So that's where I look at stellate ganglion blocks niche among some others that are also being potentially studied for usefulness. But I think that's different than saying, well, if you've tried all these things and they've all failed, then maybe you should try this other thing. To me, that doesn't make sense. In most of other medicine, we'll attack things with a variety of other treatments in parallel. So I do think, particularly with the individual variability in PTSD, it's very hard to study something that's so heterogeneous. There's 636,000 different combinations of symptoms that can get you to the diagnosis of PTSD. It's very, very hard to study that with such a regimented randomized controlled trial to then tease out what's good for everyone. So I'm just acknowledging, I'm not throwing my hands up in any way. I just think that a less dogmatic approach for this particular topic in medicine can be quite helpful by combining treatments that may make the therapy that's proven even more effective and for the duration to last longer. I hope that answers the question.
Oh, heck yeah, guys, we are running out of time here. Zoom's going to shut us down. I want to thank everybody